Hi, good morning. My name is Dr. Fatima Iqbal from Crabtree Health. I wanted to present a small presentation to you guys regarding estrogen dominance in women and why diet and exercise is not enough when it comes to weight loss. Um, I am a board certified internal medicine and obesity medicine specialist, and I have my practice here in Raleigh, North Carolina. We focus a lot on women's health, particularly on hormonal imbalances in women that can lead to weight gain, brain fog, hot flashes, anxiety, palpitations, many issues that are perimenopausal and menopausal, PCOS, fibroids. So there was a new study that claims that fibroids are a result or have had improvement with lifestyle changes. So we try to accomplish many things here at Crabtree Health, with our women, usually focusing a lot more on their hormonal issues and balancing things in a safe and effective manner. So what is estrogen dominance? This is a very interesting concept that has been talked about a lot, but there hasn't really been any sane ways in which primary care has tackled this. So one thing that we do in our primary care setting is we help our women achieve balance in their hormones. Why is estrogen balance so important? So there is an imbalance. So we do have two very main hormones as women, estrogen and progesterone. Too much estrogen relative to other hormones can lead to disruptions. They can cause symptoms like perimenopause, menopause, and particularly this becomes more prominent in women that have PCOS. So it's not just about having high estrogen levels, it's about the ratio, the balance that is needed between estrogen and progesterone. So even if your lab results are falling within a certain normal range, there is an effect of estrogen dominance that is throwing the balance off. So, our norm values may not necessarily be norm for some people. They may still be experiencing symptoms. It usually appears during major hormonal transitions, perimenopause, menopause, during the postpartum period, and particularly in PCOS. So a lot of women I see that are undergoing changes because of PCOS. Weight gain is a real concern with them. Hirsutism with excess facial hair growth, in particular missed periods, thyroid disorder. So a lot of factors that come into this effect. That we can manage. So a lot of times, the go-to drug is hormone with the oral contraceptives to deal with the PCOS component. However, I believe here at Crabtree Health, it's more than just using oral contraceptives and just putting a band-aid on the problem. There has to be a deeper analysis to see why they are experiencing these symptoms. So recognizing the signs of estrogen dominance becomes important. So how can we tell? So when you come in as a patient, we talk about many things that may be pinpoint signs that can guide towards whether your hormones are in balance and how much are they impacting your day-to-day life. So symptoms like weight gain, the most common symptom, that we see is weight gain, particularly along the hips, the thighs, the belly area, the upper arms, persistent bloating, fluid retention, which can be a very problematic because it causes that weight gain effect as well. Breast tenderness and swelling is another one. And of course, irregular periods. So, women definitely come in when they experience irregular periods, but there are other signs that also need to be looked into. I have seen from my experience a lot of anxiety in women that are undergoing hormonal changes or hormonal shifts. There's easier irritability. It's definitely notable within the family structure as well, particularly a lot of women when they have children, they notice they get easily irritated by things. They're not able to really have a good quality time with the children because of this factor. Fatigue, very, very common too. A lot of women would complain about not experiencing a good restful day, just feeling tired all the time. Most of the time is spent just sitting down and not feeling like doing much activities. Brain fog is very common as well. This is one of the signs of perimenopause. You're experiencing just not, being able to concentrate. The concentration is really affected, and sleep disturbances. Of course, this is very much to the book, where sleep disturbances will happen if you're having hot flashes, if you're having heightened anxiety, if you have thoughts in your mind. Of course, it's going to impact your sleep. So these symptoms become something that we want to look and address, and see if this is a picture of a broader problem, which is whether we need to do hormone testing at this time to see whether these symptoms are cause of a hormonal imbalance. So why does estrogen changes lead to your to basically a hindrance in your weight loss efforts? It's a very, very common scenario. So our setup here, the way that things are so far, patients are coming in. When they come in, they get a full assessment to see whether they have an hormonal imbalance. And we utilize both cash services and insurance services to check their hormones to see where the imbalance lies, and in most cases start the correction process right away so that they can start reaping the benefits of it. Why is this a problem? Like, what is the difference between men and women when it comes to weight loss? Women hormones are much more sensitive when it comes to weight gain. Insulin resistance can be a real factor. So our type 2 diabetics are people who are now becoming pre-diabetes at an earlier age. We are not just checking the A1C number, we're also looking into the fasting insulin as well as the blood glucose to see whether there is a rise in the insulin happening that may be pointing towards a bigger problem. So elevated estrogen will increase the insulin resistance. It makes it hard for your body to burn fat, store fat in that sense, particularly along the middle section. So we do measure the abdominal girth to see, how much is that out of proportion. The high level of estrogen, it's an abnormal state per se. So it causes the fat to accumulate at a faster level. It's very dangerous because visceral fat, which is the fat around our organs, tends to cause more organ damage than anything. It tends to make your organs more sluggish, if anything. So the abdominal fat is a real problem, the central obesity, if you will. If the estrogen is on the higher side, it starts interfering. So a lot has to do with the binding capacity too. Is it going to let our thyroid really function properly? Not really. That leads to slowing down of your metabolism. Even if people, like I've had many patients who say, I'm not eating anything and I'm not losing weight. Maybe there is another problem that needs to be addressed in this sense, where there might be a estrogen dominance effect. There may be a thyroid issue here that needs to be corrected. So it's very common. It's not something that is unheard of, that despite the fact that we have a higher level of calorie loss, we are still not able to lose weight. And then inflammation, this is something that is very problematic because it leads to problems overall with the thyroid, with the gut, with the hormone signaling. It leads to a vicious cycle. So chronic inflammation starts taking over. Some women would come in with joint pains, joint tenderness, muscle tenderness, just overall the feeling of fatigue, because your body is now fighting off inflammation. It just feels tired overall. So chronic inflammation leads to overall fatigue in general. These become very common in this scenario. So, understanding the root causes of things, it just doesn't happen overnight, right? We're not just automatically noticing these symptoms one day. It happens over time. And usually when women are coming to me, it's been going on for several years. As you enter the perimenopause phase, so as we go into our 40s, heading into our 50s, the progesterone levels, they are going to drop faster than estrogen. It creates an imbalance. So if you have a higher level of estrogen, and then, as we age and, we are going down on our progesterone, it really creates a more evident imbalance, which leads to more symptoms, if anything. Chronic stress, a real problem in our society, I would say, in our community here in Morrisville, when women are coming in, They are not just managing one task, they're managing multiple tasks. It's becoming very common that they're seeing a high level of cortisol, which has been present for a long time. And now at some point, the cortisol levels start declining as well, or the attention is diverted from basically dealing with the stress mostly, and then less production of hormones. So that also really impacts the estrogen and progesterone balance that is needed for basically a sane life, right? A good quality of life, a normal balance of your mental health, your weight. So all these things really start taking an impact. And then insulin dysfunction, poor diet quality, decreased muscle mass. So, one thing we also do here at the practice is we measure the muscle mass. We want to make sure that when you are losing weight, you're not losing muscle mass, you're losing fat pounds. So that is an important component of an overall a good weight loss program, in my opinion. If you are just telling somebody is losing weight, they feel great, like, yeah, I lost 8 pounds, but lo and behold, you lost muscle mass. That's not a good thing, because that could lead to problems as you go forward. And particularly with these new drugs, the GLP-1s that are so easily prescribed now, the Wegovys and the Ozempics that are so easily prescribed, there's a real risk of muscle loss with them. So that has to be monitored, and in my opinion, that has to be regulated in a sense. If you are losing more muscle mass, that is problematic as you go forward, because that could lead to basically frailty in your older age. So environmental toxins, very common knowledge. Again, this is something that has been talked about by many experts, that we are just living in an environment where there's a lot of higher level of estrogen. So our plastic use, our household items, even our skincare products, they add to the level of estrogen in the body. And the poor detoxification from the liver. So the liver is so important. It's a good organ. It's your detoxifying organ. So some people will go on a liver detox diet and they feel like they've lost weight because of that. There is an effect overall with the liver where it is really trying hard to detoxify the excess or the dangerous toxins that we put into our body. So the liver has to be in optimum shape in order for the hormones to stay balanced. So this is a great slide that talks about what kind of tests that we do here at Crabtree Health. As someone who is a expert in women's hormones, we go beyond the general primary care realm, right? You come, you have your primary care appointment. Yeah, we do the basic blood work. Everything looks good. Thyroid's good. A1C looks okay. Just watch your diet and go ahead. You're good to go, right? So that's not what we do. We want to test a little bit more than that. We want to address some of these underlying issues. So we are delving into the hormonal testing. Fasting insulin, which helps us detect whether you are in early phase of heading into diabetes. Catching things early is important. So what is primary care, right? It's preventative medicine. Estrogen testing becomes important in a sense. The progesterone becomes important. So we're looking at the levels. I also, I would add to this slides, we also do testosterone testing for women as well, because a lot of times, with chronic inflammation, with elevated blood glucose, with chronic stress, testosterone has become deficient in women. And sometimes just adding a small dose of testosterone really helps pump up the energy as well as assist them in weight loss. Of course, we check thyroid hormones as well. So what is our comprehensive strategy? Basically, we talk a lot about how we can really change things in a lifestyle manner as well. So we kind of have a unique setup where we talk more deeply about how we can help make detoxification as well as resetting of the body back into a normal rhythm where it can really start balancing the hormones out. And so we focus a lot about food. We focus a lot on lifestyle. We focus a lot on balancing things overall. Even when it comes to mental health, we work with therapists. So everything has to be looked into. Sleep has to be looked into, whether you need more further sleep analysis to get your sleep in order. All of these things make part of a successful program that helps women with not just weight loss, but also helps them overall as they head into their 40s and their 50s and their 60s to lead a more healthier life, a more stronger life where they can stay healthier, have a better quality of life going forward. So of course we are also checking the hormones, balancing them. We are working with weight loss strategies. We are checking them back every month. If medications like GLP-1s are needed, we add that on as well. But we always strive to help them lose weight more naturally. Supplements can become important too, because we use regulated, tested supplements to help assist people with if they have any deficiencies that need to be corrected. So this is also a wonderful slide. I cannot stress enough, the importance of doing a little bit more than primary care. We really don't want to be I really didn't think that I'm doing anybody any favors by just putting a Band-Aid on the problem. So our approach is a little bit more deeper than general primary care. We're looking deeply into the hormones. We're looking deeply into the diet. Appointments are longer, of course. We have a team that works with us. I have a health coach that help assist people with their lifestyle management. I have a diet that is created particularly for women with hormonal imbalance. So we have supplements that we recommend along with, if there's medications that are added on. So it's a lot more than just a general primary care visit. You are getting more value from this, in my opinion. And I am proud to say that our women do see the effects of it, and they are improving one woman at a time. So, this has been a very, very interesting presentation. I'm sure for a lot of you who are still struggling with finding out what you need to do further, whether you need to see a specialist to get your hormones tested. Not necessarily, we are able to do it within the primary care setting using your general insurance or simple cash pricing. We have good approaches with the labs. We have decent pricing for most of our plans. So it really helps people to make this program as affordable as we can, to utilize all the resources that are necessary for our women to seek healthier and more sustained lifestyles that are worry-free, that are not plaguing them with irritability, that's helping them lose weight and balancing their hormones lifelong. So your hormones are not your enemies, they are your friends. We strive to balance hormones, not just with lifestyle, but also the utilization of medication, of supplements, of testing, of fine-tuning to making sure that we stay in a right balance of hormones. I hope this has been helpful for you, and you are welcome to go to the website at www.crabtreehealth.com. You can schedule an appointment in person or telehealth. Either way works just fine. We do practice in the state of North Carolina, and so for hormone testing, that could be wise to do so.